All right, let's get to our good friend Ben Knotts. Ben Knotts, the Virginia Legislative Director for Americans for Prosperity, Virginia chapter. Ben Knotts has been a one-man gang in working on telemedicine. Finally, the president takes up his cause because we had success with it in Virginia. We're trying to get this done nationally. So telemedicine, so you can pick up the phone and call your doctor. You can do a video conference. You can go across state lines. Your doctor can be in New Jersey, and you can live in Chesapeake, and you can get him on the video, and they can prescribe things. So can his practitioner. So that's the object of telemedicine, to increase the supply of med rather than work on the cost and demand side. Very, very visionary approach. Ben, I want to start, though, with the clip here. This is Dr. Karen Rubin saying on February 4th, talking about HB 1332, she says we've got to pass that to help us deal with COVID-19, the coronavirus, which basically is telemedicine across state lines. Let's run that clip, and then we'll go straight to Ben.
To tackle some of the Commonwealth's most significant challenges, such as substance use disorder, mental health access, high-risk pregnancies, and even the application of a telemedicine platform for the management of dangerous infectious diseases such as Ebola and now the coronavirus, so very relevant today.
Joining us now, Ben Knotts, Legislative Director, Americans for Prosperity, Virginia chapter. Hey, Ben, great to have you, man.
Good morning, John.
So we just ran that clip. I know you've been such an advocate of telemedicine. Give us your view now on where we are with this. The president now taking it up in his press conference the other day.
Yeah, so what happened yesterday was a major accomplishment for the regular Virginian, regular American that says, I've really seen the status quo of healthcare not change. It shouldn't have took this happening for our legislators and our public to really think this is a good idea. We've been trying to do this for years. So he basically said, if you're on Medicare, right now we're going to start reimbursing for telemedicine. He directed CMS to make sure that they're reimbursing for telehealth, telemedicine, and most importantly, what our bill and what Karen was speaking to specifically was remote patient monitoring. If someone doesn't need to be in an ER because they can get appropriate care in the home and a doctor's willing to provide that, they should be reimbursed for providing that service. It keeps them out of the ER, and it gets great quality care right in the home. And so that is what we can get. While we passed the bill this year, they didn't want to pay for that still. So because of the president's actions yesterday, we now can pay for remote patient monitoring in the home, which keeps people out of the ER if they don't need to be in there. If they can get appropriate care in the home, quality care in the home, it can be done now, and that is major. What we're asking for is saying, yeah, this is good, but this shouldn't be a temporary thing. This needs to be a permanent fix. The legislature needs to make this permanent, and it doesn't need to be a temporary thing. So this is a big deal, and everybody should be really applauding the president for this, because this is going to remove tons of barriers to getting care in the comfort of your home and not having to go out and either spread the disease or spread the virus or contract the virus just because you're trying to get care. So that's a major deal.
Well, the other thing it does, Ben, is it frees up hospital beds, it frees up emergency rooms, it frees up doctors' inpatient face-to-face time. I mean, that's the other thing. I mean, one of the big crises that hasn't happened now, but that we're preparing for the potential of is shortage of beds, shortage of facilities. That's why we've brought in the Army of Corps of Engineers in New York, et cetera. But every time you can do this without going to the doctor, you save a bed.
Yeah, and it's a fact that RPM, remote patient monitoring, is one of the most efficient tools to increasing access and quality of care and keeping people out of the ER. We need the hospital beds, especially in a crisis like this, because Virginia's got our hospital beds capped. We've capped the amount we have to do. And it really frustrates me that we've capped the access to care, and now we're going to see some of the consequences for that. But with innovations like this is the way to answer the demand. This is a way to answer the access problem and not sacrifice quality. It saves lives. It saves money. This should be a permanent fix. So I can't applaud the president enough. When he said it, I literally yelled in the room and got 20 people started texting me. They're like, "Did you see what just happened?" So, I mean, this is a major, major deal, and I can't applaud the president enough about it, John.
So the breakthrough here is obviously the president taking up the cause of telemedicine during a health crisis. But successful, why would you roll the clock back on it, right? It's only going to expand from there. Don't you agree?
That is the exact point we're making. It's that it shouldn't have took a crisis for everyone to see how great this is. The data was there already. This isn't something somebody discovered overnight. The president took bold action to say telehealth isn't what people think it was 5 or 10 years ago. It is really taking strides daily, and it is the tool that we can use to address this, give people quality care in a way that they've never seen before. So we're hoping the data will show this is valid, even more so than it already does, and this will become a permanent fix, and our legislature will take action. Because right now, they could go, they've still got the budget negotiations open. They could add remote patient monitoring back into the state budget and get that done and not make us wait till 2021. And I think it's all the more important that they do that now. But for now, the president has given this relief, the means of using it, so that providers know that they can offer this service and they'll be reimbursed and they're not going to be on the hook for it. So this is I'll say it every time I stop talking, John. It's a big, big deal. Everybody should call the president if they have anybody and thank him. And if they have anybody that says, what's the president doing to address this? This is one of the single most important things he could do to increase access to care and slow the spread of the virus.
No question about it, Ben. I think it was Tommy Norman was asking for a special session another day or two of the legislature to meet. He sent a letter to the governor. I kind of agree with that. I mean, we're in a crisis. I think they ought to meet and do what needs to be done, or certainly look at the various options that might be affecting Virginia. If they do, can you reintroduce this bill? Can we get a version of it now?
Well, yeah. So here's the thing: is last year we said that we made it explicit in the language that Medicaid has permission to do this. The DMAS has permission to do this. It's been a funding issue. So what our bill did this year is it mandated it to say, yes, you're going to do it, and we needed to have the funds to provide it. All they have to do is if they were to reconvene for session on the budget, all the governor would have to do is say, hey, given the crisis, we need to allocate the money to make sure we provide this service. And if it has to come from somewhere else in our present circumstances, I think it makes sense. So I'm hoping that somebody can do that. And John, I haven't mentioned this enough that Senator Bill Stanley had a companion bill for remote patient monitoring that was scaled back a little more than ours, but they wouldn't even pay for his, and his was targeted to priority populations in rural areas, and they didn't even give his bill a hearing on when it switched after crossover in the Finance Committee. So there's been a lot of efforts to try and tackle this. So I really hope that this. Unfortunately, I hate that it takes this to get people to say, yeah, we should be providing this service. We should be paying for this. It's just really unfortunate that it took this to get them to even have this conversation.
That is unfortunate, and there's a lot of lobbyists, obviously, that don't want to see this happen in order to, maximize an insurance take or minimize insurance payout, whatever the lobbyists do. There's always resistance to change within a Goliath business like healthcare. But having said that, you hate this, like you say, you hate to say, Ben Knotts, a crisis is what loosened this up, but it is what it is. And I just want to take advantage of this particular aspect now because I think it's got very long-term positive ramifications. I'll give you a perfect example how things have changed that people are doing. My wife has been sick since she got back from Nevada. So she got sick and she's got the flu. We don't think it's the coronavirus, but she's got the flu. All the symptoms of a flu, headache, fever, coughing, sore throat. She's got a bad flu. Rather than go to the doctor's room and wait, doctor's office and wait in the waiting room, she just called him up. They had a phone conversation. They did a, what do you call that video thing that people do, that televideo. He took a look at her. He asked her 8 questions. He prescribed something. She's feeling better. She never had to go to the doctor. She didn't have to wait there, maybe get sick in the waiting room by someone else. That's the efficiency that we're after here, right?
Yeah, and just think about it. if you're sick and you go to a waiting room and you're sharing whatever you have if it's highly contagious, that is not a good situation for anybody. But if you're a mom and you're a single mom and you got 3 kids, and you got to drag them all to the waiting room, and your kids get sick or they spread it. I mean, this innovation is so important to improving the quality of life of those that are sick. They're already down on their luck. They're already having stuff. Everybody agrees waiting rooms suck. You need to get care in your home if it's possible. And this innovation, in many ways, is better care, and it's saving lives and it's saving money. And everybody should be on board with that. Everybody should like that. And so I'm super excited to see what's happening, because people are going to, if people that use this, when they talk to their doctor on their smartphone, the more they use it, the more they're going to say, well, why aren't we doing this on a wider scale? Why aren't we letting people on Medicaid do this? Why aren't we enabling doctors to monitor people in their homes if they don't need to be in a hospital bed and they can still get great care? So you can go down the list and you can see all the practical applications, and there's just no reason these barriers need to remain once we beat this thing.
Ben Knotts, thanks for being with us on short notice. You're a visionary in this field. Ben Knotts on telemedicine. He's the legislative director for Americans Prosperity Virginia chapter. Ben, thanks for being with us.